Well, death may not be a topic we like to regularly think about, but our guest this evening has a new book to help us view the end of life with Catholic hope. Dr. Stephen Doran is a board-certified neurosurgeon with more than 25 years of experience and is a permanent deacon and bioethicist for the Archdiocese of Omaha. His writings in bioethics, neurosurgery, and gene therapy for brain disorders have been widely published in national media outlets, academic journals, and neurosurgery textbooks. His latest book is from Ignatius Press, and it's called To Die Well, a Catholic Neurosurgeon's Guide to the End of Life. Welcome to the Busted Halo Show, Dr. Stephen Doran.
Well, thank you so much for having me. It's my pleasure, and I'm excited to be here.
No, so in our context here, probably not at the big conventions or in the medical journals, but should I call you Deacon Steve? Do you prefer that? Or Dr. Doran?
You can call me Steve. Deacon Steve is great.
Okay, all right, Steve.
Steve is great. Let's go, Steve.
So before we get, because people are now listening, they're going, oh, good, I have questions about some stuff, and my elderly parent is at this stage, and I want to make sure I got all my ducks in a row. But I'm curious about your own particular path to where you are now, which is bioethicist, neurosurgeon, and author and permanent deacon. Was it for you, would you say your faith journey and your faith life, developing, growing, ran parallel to your vocation as a doctor and neurosurgeon, or did kind of one precede the other, if you will?
Well, I think they've at times been parallel. Sometimes they've intersected with each other. I would love to say that my life has been fully integrated, not always, and
Well,
sometimes, yeah. But yeah, I mean, I hope that my faith informs my marriage, first of all, my kids, and then after that, any career things, neurosurgery and the diaconate. And so, yeah, I try, not always succeed to have those all integrated together.
well, you talk in some of your materials, you're talking in your book about kind of keeping death, like a lot of us do, sort of as an abstract at arm's length. You talked even about family members that passed away. And I think people would be surprised to hear that, like as a doctor. They probably think, well, a lot of us don't want to think about that. But doctors, they deal with that all the time.
Yeah, it's funny how doctors are about things. I mean, I think unfortunately many times patients are seen, I hate to say this, more as a task than a person in front of them, and it's yet another thing to do. And I know that's a pretty broad brush I'm painting with, but
Yeah.
through the busyness, through the stress, through the emotional ups and downs, I think sometimes you know, I like to use the word death has become medicalized, and illness is the disease, and medicine is the tools, the weapons to fight that disease, and when that battle fails, well, we just kind of move on to the next battle. And so death is, yeah, it's there, but it's just not really thought about, hardly contemplated about, and almost never prayed about.
Well, and you say just in our world, our society in general, in the book, you say that it seems like we have a paradoxical attitude towards death. What do you mean? In what way?
Well, it's funny. I mean, you violent video games, rap music, that death is glorified in a warped way. Yet when we think about what death really is, and I think that's important for Catholics to realize. I mean, death is more than just the cessation of our bodily function. It's this unnatural separation of the soul from the body. And so the spiritual realities of death have been largely ignored, whereas the kind of biological realities have been glorified in a weird way in our culture.
Mhm. Well, Dr. Stephen Doran is our guest here on the Busted Hill Show. He's a permanent deacon in the Archdiocese of Omaha and consults with the Archdiocese on ethical and medical and moral issues. And his new book is called To Die Well, a Catholic Neurosurgeon's Guide to the End of Life. Would you say, like, if people are thinking about this, oh, would this be helpful, or is it going to be too technical and medical? Do I need like a master's degree to understand? Or did you explain things so that we can all understand?
Well, I hope more the
I
latter
hope
than the
so.
former. I hope so. If I didn't, I failed miserably. So, yeah, you know what I did? I mean, I've been blessed to be part of a lot of different people's lives, both as professionally with patients and my family, extended family. And so, what I've tried to do is to take a story to
Mhm.
introduce a particular topic, and then use that as an entry point that will interest people in the topic, and put some, I don't know, meat on the bones, for lack of a better word, because it is abstract. It can be, and then try to take some some of the subjects are pretty nuanced, and try to boil it down a little bit without losing the integrity of the issues at hand. And I don't know. Hopefully, I succeeded in that. But yeah, some of
Sure.
these things are tough, and trying to distill it in a way that's accessible to people was my goal, and then using story to get their interest in it.
No, I appreciated that because in each topic, even on things like brain death or withdrawing care or nutrition, hydration, all these things that we maybe hear in a very sort of technical or medical way, or maybe we think of them in a big document from the bishops or something like that. You very much humanize it in each case with a story of like a patient or a family member, people that you've actually interacted with.
Yeah, that was the goal, and I think it works for the most part. I think what's been helpful is that people have come to me afterwards who've read the book and have said one of two things. One, it was I didn't have this as a resource at the time, and I just always was second guessing myself. Did I do the right thing
Yeah.
or not? And the book has brought them some consolation in that, okay, at the time I made the best decision with the information that I had, and yeah, I feel better about this, and it lifted a weight on their shoulders. A lot of them, I've heard that many times. And then the other thing is, they might be going through their own process of a serious disease, even facing death, or a family member, and they found it as a kind of a ready-made, reference to
Mhm.
look at as they go through that.
Great. Yeah.
Now that said, I've also known people who bought the book and they won't pick it up.
No,
They,
no.
it's just they're afraid, and they're like, well, it's kind of a pretty cover, but that's as far as I'm going to go with it. I've heard a number of people say, I'm going to get to it. I don't know. I'm not ready
We,
for it. I'm not
we
ready for
really
it.
like Deacon Steve, and when he had a book signing at the church, we thought, I'll buy this book. It's on the shelf. I don't. Death.
That's
Death.
exactly what happened. Yep. Yep.
Well, I mean, I like the way that you begin, and it reminds me of something in my ministry. I like the way you begin with kind of the morality questions, the sort of things that people would have probably front of mind. And I'd like to, before we let you go at some point in a few minutes, I'd like to get to what you build up to, which is the spirituality behind it too, because really, it occurs to me that at the time that I was working in campus ministry with college students and young adults, that whenever questions of morality come, it's usually around how far can we go? Like, what's the line? Give me the exact, what can we do and what we can't do? And it occurred to me in reading your book that we now that we're older, we do almost the same thing with end of life stuff. Like tell me what can I have? Is it DNR okay? It's almost kind of like the college students rewinding into earlier in life. How far can I go on a date? What's the line that the churches give? So, I mean, people certainly have those questions, and I bet you get those questions all the time. But as an ethicist with an archdiocese, where we have to kind of begin is implanting all of our church members with kind of a helpful knowledge and basis, because it's not always like, here's the list of good and here's a list of like do this and don't do this. Because a lot of people will ask, we can start just as a way to get into the conversation. People say, well, am I allowed to, as a Catholic, can I have a DNR? And the answer is, well, perhaps, or certain DNRs or whatnot. So get us into some of that. I mean, is it as easy as can you just hand out a list of things that I can sign a document that says this is okay according to my faith, this is not?
Well, wouldn't it be great if it were that simple? And I think that's
Well, that's
what
what people often want. Yeah.
yeah, give me the laundry list. Tell me what to do and I'll do it.
Right.
I think that this is what the problem is with it, with this advanced directives. I think people are familiar with that. I mean, when you check in a hospital, they ask you have an advanced directive, and advanced directives are legal documents which are intended to help decision making when you're nearing death if you can't make those decisions for yourself. And there's three basic ones. There's the durable power of attorney for medical care, and then there's a living will, and then there's this newer one called POST, POST. And I even have to look up what it stands for. It says physician orders for life-sustaining treatment. Basically, what the problem is with the latter two things is that it's an attempt to do exactly what you said. I'm going to put down a list of do this, don't do that, and this is what I want. Well, the problem with that is it's impossible to anticipate, the circumstances that might be present when you're seriously ill or injured, and to try to anticipate that and make decisions in advance is almost impossible, and it can kind of box people into a situation where they might feel compelled, or in the case of a POST, which is actually a physician order, compelled, you have to follow it, and so you run into scenarios where unintended consequences of having decisions made, which maybe you really wouldn't have want made at the time, and they may become in conflict with your own faith. So, if people remember anything from this talk, I would say the most important thing you can do is to have a power of attorney for your medical care, and talk to that person. Don't just put them down on your will, but someone you love, someone who knows you, someone who shares your faith. Have some conversations so that they have an idea of what your desires are. And so then in the event that you're not able to make those decisions, they can make them for you. By far and away, that's the most important thing for advanced directive. Now, if you really want to get down and do a kind of a laundry list of what you think you want, well, that's fine, but you still have the power of attorney to help interpret that list.
So what I hear you saying is it's while the temptation may be, and this is kind of in the same topic that we began with, which is people tend to not want to, let's not talk about death, or even in your own admission, like, oh, kind of keep it at arm's length, a documentary at one point you talked about it. But so that's our temptation. So it'd be kind of easier just in my own office with the door closed to fill out this form, like check yes and check no. And I don't have to talk to anybody about it because that's awkward. But what you're saying is that's actually not as helpful and potentially ethically or morally dangerous because it's very difficult to narrow down a particular type of procedure or a particular piece of equipment and say that in all cases this would be unethical or in all cases this would be ethical. A lot of it has to do with some other factors, which we'll now begin talking about. But so what you're recommending, though, is to have a person and a person in your life that you designate, and hopefully a person that's going to be around when you're at the end of life and can't make decisions, but also a person that you've actually had a conversation with, ideally a person that who themselves shares our same Catholic faith. Obviously, it wouldn't be strictly required, but somebody that understands that and would abide by that and not, choose to make decisions. Because, like you said, if there's a medical power of attorney, they have, for the doctors in the hospital and according to society, they have the power to choose. So if you're going to choose somebody like that, you got to make sure that they're on your same page. But what we were saying is that's better because if that person is informed of Catholic teaching, they can make some of the nuanced calls that when the doctor says, well, there's this likelihood or, whatever percent of brain dead or how much we're hydrating or nutritioning, it's not just like, well, you can't resuscitate. You can't do CPR on me. That's kind of pretty binary, pretty black and white. So what I hear you saying is a person is better than a document.
Yeah, I mean, they're not entirely mutually exclusive,
Sure,
but yes,
sure.
it is. The document without a person, it can be dangerous. I mean, the person with the document's okay. It's the document without the person that you run into troubles with. I give the simple example. People say, well, I never want to be on a ventilator. Don't ever put me on a ventilator. Okay, fine. Well, what if you're otherwise very healthy, you get a serious pneumonia, and all you need is a couple days on the ventilator to have something cured, and you go back to being your normal healthy self.
Right.
So you can see where those lists can be kind of ridiculous. Well, of course, in that situation, put me on a ventilator, you're going to cure my pneumonia, and I'll go on with life. So that's where we have to be really careful about how specific we get with these instructions.
Well, or an example, we had, I think, somewhat recently on the show, somebody had an example of like, I know a person, I have a friend, and we jog together and we're both fairly young and healthy, but this person has a DNR. And they told me, like, if we're jogging, I'm DNR. I was like, well, okay, if you have like a heart incident at age like 49 and you fall down on the jogging trail, really? You don't want us to do CPR and give you another 40 years of life? Right. So that's why just the terms or the actual procedures are not full enough. They're too limiting, I think is what your point is.
Yes, exactly.
All right. Well, we're joined this evening by Dr. Stephen Doran. His new book is To Die Well, A Catholic Neurosurgeon's Guide to the End of Life. He is a permanent deacon and the bioethicist for the Archdiocese of Omaha. And I mean, you go through in the first part of the book, and like I said, the questions and what can we do and what can't we do, the first morality part, a few very common things that people hear, like about assisted nutrition and hydration. There's been a lot of famous, not only court cases, but media cases about, is somebody, quote, brain dead and should we withdraw the feeding tube or whatnot? How can we enter into some basic understanding, realizing that not everything is 100% never this or never that, but some basic understandings of where the church would come from when it comes to something like that? Hydration, nutrition, something like a feeding tube in any given, let's say, medical situation.
Well, I guess if you look at it at a very high level, is that all of us are entitled to shelter, and we're entitled to food and water. And so it would make no sense to take someone who's seriously ill and put them outside without shelter, right? So there's basic needs that we're all entitled to, and food and water is a need. It's not a medical treatment. It's a need that we have. I think if you look at it in simple terms, but then it does get nuanced. A person should not starve to death. A person should not be dehydrated to death. And if that is your starting point, then you can kind of start look at the situation where, say, someone is in the active process of dying. They're going to be dying in the very near future. A feeding tube or assisted nutrition hydration really isn't necessary, right? Because that person is dying of their fill in the blank. But if someone has a disease process that is something that can be controlled, even if fatal at some point, and withholding nutrition and hydration would cause that person to die, they would starve to death or die of dehydration, that's where the line is. Then from there, you can kind of work through the specifics of the given situation.
I remember in seminary, and maybe we've kind of come up with better terms since then because the longer I'm a priest, the longer ago that is that I was in seminary. But I remember one of the kind of key terms was ordinary or extraordinary means. Like, so somebody can morally decide, I've got pretty bad cancer, and they say they can do this, this really aggressive treatment, and I can be chemo, and it can make me sick, and maybe I'll buy another 4 months. The Catholic Church does not require. They don't say it's immoral to choose not to do that. That's not like assisted suicide to say, no, you know what? The cancer's going to kill me, whether it's now or 4 months from now, and I'd rather have a great couple of months with my family and not be really sick from all the chemo. I can choose not to do that. But I think that's where we get into that kind of extraordinary, or sometimes what they call heroic means, like trying to really go above and beyond. Or you picture like some movies where somebody's just giving compressions on the chest and the doctor says, we can stop now, and the person's definitely dead. So is that helpful to use those kind of terms, the ordinary and extraordinary, or does that get muddy?
No, I think that's still a good term. I mean, there's other ones that are thrown around, but I think for the sake of our conversation, I think that makes a lot of sense. And you're right. What is ordinary for one person may not necessarily be ordinary for the next.
Oh.
And because I've had patients who, for them, they were going to go to the absolute end with every treatment possible, knowing that ultimately they're going to die, knowing that their treatment is going to add minimal amount of time to their life, but they were going to do it. So for them, that was ordinary. But the next person, that might have been extraordinary, extraordinary.
Okay.
And so the ordinary, extraordinary it's a bit of the eye of the beholder. Now, we do have a duty to preserve life. I mean, so that's, you can't take that too far to extreme. And the other thing to remember, that treatment that may have started out as ordinary can become extraordinary at some point.
Okay.
Maybe it becomes futile. Maybe that it was working. It was doing what's supposed to do. The side effects were minimal. The benefit was good, but as time goes on, that ratio flips. Now the benefits become very minimal. Side effects and risks become higher, even with the same treatment. So those are good treatments, or good words to use. But keep in mind, there's again, you have to really look at what's going on at the time to pass any sort of judgment on this.
Dr. Stephen Doran is our guest here on the Busted Halo Show. His book we're talking about is called To Die Well, a Catholic Neurosurgeon's Guide to the End of Life. And this is something that you just mentioned, that we have a duty to preserve life, but you also make the point, you do, and obviously we all do in Catholic morality and spirituality as well, that we also believe that the cessation of living functions in the body is not our end. So obviously there's two. I find myself very often Deacon Steve, when we're out here on the Busted Halo Show, oftentimes quoting Thomas Aquinas and the fact that the virtue is the means between the two extremes, because our society tends to push people to such binary extremes, that there can be an extreme of must preserve life. Cut back to the scene I just imagined with somebody doing the chest compressions and the doctor has to put their hand on the shoulder and say, it's over, it's done, versus the other side, where tending to be where kind of our society is pushing a little bit, we would say, immorally and not with a respect for life, that we might as well just do assisted suicide, or at any point when it becomes painful or a financial burden, well, then let's just end. But really the virtue is somewhere in between. And that, since we believe in eternal life, for Catholics, there's not this ultimate, we must preserve or must extend life by every possible minute or another week added on to life, because life with God is our ultimate goal. But also, as you said, we do have a duty to preserve it and not just sort of watch somebody die if that can be helped.
Well, I think you all know as well as I do, we live in a throwaway culture, and
Yeah.
at the end of life, and now, or especially the beginning of life, now we're seeing more and more at the end of life. That which is not perceived as valuable, we're going to get rid of and throw away. So, but I'm just mindful. What does Saint Paul says? He says, "Whether I live for the Lord or I die for the Lord, I'm the Lord's." I mean,
Yeah.
we always have to remember we are living or dying for the Lord, and that our ultimate destiny is union with Him in heaven, and death is the way by which we get there, and then ultimately is fully realized in the resurrection from the dead. So we have to maintain this eternal perspective when we talk about these things. And I think that's the problem, when if one of the reasons why I put both moral and spiritual is that if you divorce the two from each other, you're missing out. I think both are equally important, and we have to keep in mind what is our destiny. What's our ultimate destiny? It's union with God in heaven.
So, because I'm sure people have so many questions, I want to at least highlight, while you're still on the call with us, that for one thing, when people have questions about, but what particularly, what is palliative care? Is that okay? Is hospice okay? Is hospice like giving up? Is that the same as assisted suicide? A couple of great resources, one of which, of course, is your book that we're talking about, that goes into a lot more about definitions, about advanced directives and hospice and pain control and what happens towards the end of life, and how, we sort of dance on the morality of that, and you're fleshing that out more. But you also recommend in the book that the USCCB, the U.S. Conference of Catholic Bishops, has some pretty good guidance for people that are thinking about and preparing their end of life directives, right?
Right. There's some good resources there. The National Catholic Bioethics Center has a lot of stuff you can download if you're looking for, documents to guide your thinking. So yeah, there's good resources out there, good things that you can trust.
And those sort of things would be like when you designate your person legally, you'd like maybe print out a bunch of that and sit down over lunch and go, okay, so let's just, and not like, okay, so tell me, do you want this? Do you want chemo or no? Do you want, should I unplug you from the ventilator or no? Not those sort of things, but let's talk about all these things so that person is at least a little more informed and can be aware of what you desire at the end of your life. All right, so
Well,
there's much more to talk about there, but I really do. I want to get back to the title of your book, that because you introduce in the spirituality portion of the book, dying well. So what is that from a Catholic perspective?
well, I'll tell you what it's not, first of all, because I think that's because society wants to say dying well is a peaceful, quiet, pain-free death surrounded by family, friends, and loved ones. Beautiful. If that happens, that's wonderful. But that is not the measure of a good death, and from a spiritual perspective, because
Hmm.
I mean, look at Jesus. He had the most horrific death
That's
ever,
true.
and it was the best death ever, the dying well par excellence. So then what is the measure of a good death? Well, I think we have to go back to where this begins. It begins at our baptism, where we're living towards this ultimate destiny of union with God. So a good death comes by virtue of living a good life. St. Robert Bellarmine wrote about this. This is nothing new. These ideas of dying well have been around forever. And he said very simply, what should be self-evident is like, if you want to die well, you have to live well. So living a life of virtue, frequenting the sacraments, seeking reconciliation when relationships, that ultimately is what's going to lead to a good death. It's not necessarily going to be pain-free. It might be super messy and super hard, because what we're looking for is heaven. What we're looking for is union with God. And so the death that is oriented towards God is indeed what a good death is.
As opposed to a phrase that we hear a lot in culture and society, which is death with dignity, which oftentimes is kind of code word. It's kind of like how people have co-opted the word choice. Well, everybody thinks choices are good. It's like, oh, wait, by that you mean have an abortion. But when we say death with dignity, a lot of times that means that any sort of suffering, let's at least just start there, that any sort of suffering must be avoided at all costs. And it's not dignified if I suffer towards the end of my life.
Right, right. You're exactly right. It's a perspective that anything other than perfection is not wanted, so we're going to throw it away. And again, in my mind, the perfect death is no pain, surrounded by loved ones. If it's not that, then I don't want it.
but also very practical concerns, like if it looks like I need a lot of end-of-life care that's going to go on for months or years and nursing home costs, I don't want to be a burden to my family. And to be fair, in your section on morality, the Catholic Church does not completely extrapolate that those are factors that can affect some of these, how extraordinary are the means, but these days, with a lot of this death with dignity sort of movement, it's, if anything costs any money, or if anybody even suffers a little bit, or if I don't have full productivity or full function, then that's not dignified, and we gotta end it quickly.
Yep. Unfortunately, that's the case. I agree.
Well, the book we are talking about is To Die Well, a Catholic Neurosurgeon's Guide to the End of Life. We're joined by a Catholic deacon, neurosurgeon, and ethicist for the Archdiocese of Omaha, Dr. Stephen Doran, and so much more to talk about. I hope you don't mind if, as we say goodbye, I might say, gee, it'd be great to have you back on, and we'll unpack some more of this stuff.
I would love it. You're fun.
Oh, thanks. Okay. We like to be fun, particularly when we're talking about death. Yes.
Yeah, why not?
Why not? All right. Well, what we're going to do, we're going to put a link on our radio blog, which our listeners know to go to at the end of any show when they want to find out more. That's bustedhalo.com/radio. We'll put a link to where you can pick this up from Ignatius Press. And Deacon Steve, thanks for joining us.
My pleasure. Thank you so much for having me.